Hello, everyone. Thank you so much for your patience. We're letting you all in. Thank you so much for being here, everyone. We're going to go ahead and get started in a couple of seconds. So appreciate you being here. Great. All right. So we're going to go ahead and get started for the sake of time. So hello, everyone, and welcome to tonight's event. Thank you so much for joining us for Living with Tourette and ADHD, a community perspective. My name is Dao Duong, and I am the program lead for professional and community education here at the Tourette Association of America. You've seen me before in some other webinars. I'm also joined tonight by my colleague, Alexandra Walsh, Manager of Programs, who will be helping me out in the Q&A and chat. And I just wanted to say before we start that tonight's event is being provided as part of the Tourette Health and Education Program in partnership with the CDC. The views expressed by speakers and moderators do not necessarily reflect the official policies of the Department of Health and Human Services, nor does the mention of trade names, commercial practices, or organizations imply endorsement by the U.S. government. So we are so excited to present tonight's roundtable panelists in partnership actually with children and adults with attention deficit hyperactivity disorder, also known as CHADD, a leading nonprofit organization serving people affected by ADHD. So we'll be hearing from different individuals tonight, individuals who have TS and ADHD, and hear from a parent, the clinical and educator perspective on supporting individuals with TS and ADHD. So with that, I'm going to go ahead and launch into bios. Our wonderful speakers for tonight, you see in front of you tonight. Alicia Santiago, hi Alicia, is an 18-year-old rising leader for the Tourette Association of America, born and raised in Bronx, New York. Currently, Alicia is the first-year creative media student at Champlain College in Burlington, Vermont. From the age of 7 years old, Alicia began to exhibit symptoms of Tourette's, but was not diagnosed until she was 14 years old. Since her diagnosis at 14 years old, she's been a fierce advocate for Tourette syndrome and does everything she can to help bring awareness to the disorder and joined the TAA in 2021 at the age of 16. Next, we have Emily Coonrod. Hi, Emily. Emily has more than 15 years of experience as a classroom teacher, instructional coach, and professional development creator. She has a graduate degree from the University of Iowa in educational leadership. Emily is currently serving her local education agency as a professional development consultant, conducting frequent in-services to educators across Iowa and training educators on presenting and facilitation best practices. She has volunteered with the TAA as an educational presenter, sharing TS learning to educators throughout the country. Emily has 2 children, both with ADHD and one with TS and OCD. She enjoys helping her children learn about themselves and how to advocate for their educational needs. Next, we have Jeremy Didier. Jeremy has over 15 years of extensive experience working with children, parents, and adults with ADHD in both her personal life and as an ICF, JST, ADDCA, all the alphabet soup there, certified ADHD coach with Impact Parents. She currently provides assessment, diagnosis, and therapeutic services for adults with ADHD in her private practice at Jordan Psychological Center in Kansas City. She's also the group founder and the co-coordinator of Kansas City's award-winning CHADD chapter, ADHD KC, twice recognized as the organization's chapter of the year. Prior to being elected president of CHADD's board of directors, Jeremy also served on the board in many other capacities too. She's also a nationally recognized speaker and a frequent contributor to national media outlets such as the Washington Post, NBC Nightly News. A passionate advocate for justice-involved individuals with ADHD, she specializes in the underdiagnosis of girls and women with ADHD and the intersection of ADHD and addiction. Diagnosed with ADHD as an adult, she was honored to be selected for Chris Ziegler-Dendy's inaugural advocacy training program at Camp Dendy. So Jeremy holds a Master of Social Work from Fordham University and a Bachelor of Science in Journalism from the University of Kansas. Her favorite job is being mom to 5 fabulous kiddos, 4 of whom also have ADHD, among other neurodiversities. So one of those kiddos is here with us tonight, Jeremy. So Jeremy's daughter, Sophie Didier, an award-winning artist and nationally recognized public speaker, a college athlete in women's lacrosse, and just graduated with her master's in environmental science and policy at Clark University. Sophie is a frequent presenter on the critically important topic of the underdiagnosis of girls and women with ADHD, and recently appeared on the cover of the best-selling book, Launching into Young Adulthood with ADHD, Ready or Not, written by Chris Ziegler-Denny and Ruth Hughes. Sophie is a passionate advocate for women in STEM, and she thanks her four brothers for allowing her to be the Didier diva growing up. Sophie identifies as a young adult with ADHD, Tourette Syndrome, and bipolar disorder. She's a champion for the rights of neurodiverse individuals around the world. And last but not least, we have Dr. Max Wiznitzer with us. He's a graduate of Northwestern University School of Medicine. He trained in pediatrics and developmental disorders at Cincinnati Children's Hospital and in pediatric neurology at the Children's Hospital of Philadelphia. He then did a National Institutes of Health funded fellowship in disorders of higher cortical functioning in children at the Albert Einstein College of Medicine in New York. So since 1986, he's been a pediatric neurologist at Rainbow Babies and Children's Hospital in Cleveland, Ohio. He's also a professor of pediatrics and neurology at Case Western Reserve University. He has a long-standing interest in neurodevelopmental disabilities, especially attention deficit hyperactivity disorder and autism, and has been involved in local, state, and national committees and initiatives, including autism treatment research, Ohio Autism Service Guidelines, autism screening, and early identification of developmental disabilities. All right. With that, I'm going to go ahead and start our conversation tonight with our first question for our roundtable panelists. So, Dr. Wiznitzer, I actually like to go to you first. Can you explain how ADHD may occur with Tourette syndrome? Like, what are some of the symptoms to look for?
Well, the ADHD symptoms are very simple to consider. You have inattention, you have impulsivity, and you have, say, motor overactivity. People say hyperactivity, but it could be something as simple as fidgeting. From the motor standpoint, you can fidget, you can move around a lot, you can literally bounce off the walls. You can also have verbal hyperactivity, which means you talk a lot and you don't know when to be quiet. From being impulsive, impulsive is basically acting without thinking. So that's yelling things out, not waiting your turn, not having any patience for what's going on around you, interrupting people all the time. And then the inattention features are basically problems staying focused, starting to be focused, and usually on tasks that you have to do compared to what you like to do. But also, as you get older, we find problems with organization, with easy distractibility, and all these other things that are there. How does it relate to the tics themselves? There's actually a common biology. If you look at the wiring in the brain, pathways that involve ADHD when they don't work right and involve tics when they don't work right, they literally are in the same neighborhood. And there's thought to be not only a common wiring association, but also common genetic relationships that are there that basically make you predisposed to one, the other, or both, dependent on how they're going to manifest.
Oh, that's a great overview. Thank you so much, Doctor. I wanted to turn to Sophie actually and ask you, what ADHD symptoms have been most challenging for you?
Yeah, so for me personally, being able to focus is definitely one of the harder ones. It's really hard for me to maintain focus on something, especially if I'm telling a story. I go off and tell probably 6 stories in one. I get distracted. And then also the impulse part of it. So my driving record can attest to that. I have more speeding tickets than I care to admit, but yeah, so the having trouble focusing and impulsivity are the hardest parts for me.
Oh, no, thank you for sharing that, Sophie. Alicia, I want to hear from you too. Like, what ADHD symptoms impact you the most in your life?
Um, I would say that the most impactful ADHD symptoms I have would probably be how easily distracted I get, um, and my inability to sit still because of my hyperactivity and issues with my executive function.
Mhm. Thanks for sharing that. And I think, on to Jeremy, like, hearing what been shared so far, what are some of the key ways that parents can support their child with TS and ADHD?
Oh my gosh. I mean, just like any parent would do is find out as much as you can about ADHD and Tourette and how they show up for your kid. Connect with groups like this, either in person, online. I mean, there's so many fabulous options now that you can connect with. CHADD, obviously, TAA. And then just be there to support them, as Sophie wasn't diagnosed with Tourette or ADHD until she was 14. And so she didn't need, her supports were different. She was capable of advocating for herself, but, helping her kind of navigate specific situations that may be a little tricky. We helped with that, and connecting with other people who have ADHD, other teenagers at the time who had ADHD and Tourette, to kind of normalize that. Also finding, the best treatment possible for your kid. We played around with several different medicines until we got it just right. And even now she's trying new things to help with the Tourette. And so, continue to educate yourself. You're always a parent. You're always learning. You're always looking for new ways to help your kids be the best they can be and the best version of themselves that they can be. And, I think as parents too, we're always trying to be the best parent we can be. And if what we're doing isn't working, then you're trying to find a way that does work or figuring out what we can change so that we can make it better for them. That's what we did. I don't know if it helped or not, but that's how we ended up here.
No, thank you for that perspective, especially as a mom. I can't imagine all of the learnings that you've had to go through to course correct and just, like you said, help Sophie be the best that she can be. Emily, I also wanted to ask you, what are some of the biggest challenges at school actually for students with TS and ADHD? Could you share a little bit about that?
Yeah, absolutely. So Alicia and Sophie already hit on one of the biggest challenges, concentration, focus, that impulsivity.
Mhm.
That is absolutely a big challenge for both kids with ADHD and Tourette syndrome. Some other challenges that we see in the school situations are social interactions, sometimes academic performance, behavioral issues, or what teachers and school staff members might consider behavioral issues when really it's disinhibition or impulsivity. We see a lot of self-esteem and mental health frustrations, and unfortunately, sometimes there's a pretty heavy lack of teacher and peer understanding. And so I appreciate Jeremy really hitting on those supports that both CHADD and the TAA offer, because those are things that educators can lean on just like parents can lean on. And both the TAA and CHADD have a ton of things to offer. As an education volunteer for the TAA, I can speak to the free education presentations that we give to teachers and staff, educating staff across the United States. And I would just say another thing that is a challenge in schools is ensuring that students are really getting the accommodations and support that they need. Lots of students with ADHD and Tourette have a 504 plan or an IEP, but not all of them do. And as educators, we are working always to meet our students' needs and can provide accommodations and differentiate and should, whether a student has that plan in writing or not.
Oh, great. No, thank you, Emily. And I know we can put into the chat, Alexandra, the email for programs@tourette.org if you're interested in more in learning about those education and service presentations that she just mentioned. And so I wanted to actually pivot a little bit now into talking about the impact of ADHD with our roundtable panelists today. So, Sophie, I actually wanted to ask you, how has ADHD impacted your time management? Like, what have you done to be successful with time management in general?
Yeah, so procrastination and we are old friends. We go way back. It can be kind of a toxic relationship sometimes. So I find that having a schedule is really big. In college, being, an NCAA athlete, it was really helpful that I had a very strict schedule. That way I knew when I had to do my homework so that I could, do it before practice and when I was going to eat and when I had classes. So staying on a schedule is really important. Setting reminders for literally everything, reminding myself to take my meds, reminding myself to eat, reminding myself, to brush my hair, things like that. I find really helpful. And then writing everything down. I have probably like 3 different planners, just to make sure that I don't ever forget anything.
Yeah, 3 planners. Awesome. Alicia, let me ask you, so how has ADHD impacted your school life? Because I know you just graduated your first year, right? I'm not graduated, you just finished your first year of college. So what do you do to be successful in school?
Um, Similar to Sophie, because of my executive dysfunction, I often leave assignments to the last minute. So to get better about that, because that's something I struggled with since I was like as long as I could remember. I also set a lot of reminders for myself and to pay more attention in class since I do struggle with that. I always have fidget toys with me. Like I have this guy right now who's been helping me stay focused during this. And I think that fidget toys are really, really helpful to help keep your attention during class. Just like doing anything with your hands, honestly.
That's great. Thank you, Alicia. Dr. Wiznitzer, so what treatments are available for ADHD? Can you actually talk about like the use of stimulants in the TS population? Is there a true association with stimulants causing tics? Anything you can offer there? Oh, you're on mute, doctor.
Let's first talk about the treatment choices. They fall into two camps. One is the treatments that we have that will deal with the core features of ADHD. And the other treatments are the effects of the ADHD on your daily functioning. For the core features, medication is clearly the most helpful. And that's basically to improve attention, improve impulsivity, and to reduce the motor overactivity. There was the belief in the old days, and this was back in the 50s, in the 60s, that stimulant medication caused tics, number one, and number two, stimulant medication by itself aggravated tics. We now know with multiple studies that have been done, at least in populations at large, that stimulant medication in the majority of individuals with Tourette syndrome do not aggravate tic activity. If anything, they may actually reduce tic activity as your ADHD improves, your self-esteem improves, and your tic activity may also improve. However, stimulant medication can aggravate underlying anxiety or OCD. And if it does that, then it may aggravate the tics. For the non-core feature portions of ADHD, structure, I think we've been hearing this from both Sophie and Alicia. Structure, routine, consistency can be very helpful, as well as the appropriate behavioral strategies, educational and employment accommodations in order to make sure individuals are successful.
Thank you. No, thank you so much. And that's sometimes a big question, right? But you answered it really well and succinct. So thank you, doctor. Jeremy, I actually want to turn to you next. So when should people with ADHD seek outside behavior therapy, in your experience?
I mean, I think everyone with ADHD should seek behavioral therapy. It's one of the kind of the core treatments along with medication, whether it's, utilizing an ADHD coach or going to a cognitive behavioral therapist. I think it's really helpful because a lot of people with ADHD, no matter when they're diagnosed, we have sort of some false beliefs about ourselves. We're often 3 to 5 years behind our same age peers in terms of development, and particularly, in high school. I think what's the number? Kids with ADHD hear something like 20,000 negative messages a day. And that's going to take a toll on your self-esteem. So it's already tough being a teenager, let alone being a teenager with ADHD, and then a teenager with ADHD and Tourette. I think, any support that you can get in terms of therapy or coaching to help with self-esteem. And then, obviously rejection sensitive dysphoria is another big piece. We feel rejection very keenly, that painful feeling of, what do they not like me? Have I done something wrong? All of that is stuff that can be worked on with a therapist. And so I like everybody gets a therapist, everybody gets a doctor, everybody gets medication. That's just how we handle it. Yeah. And of course I'm a therapist, so I think everyone should have therapy as well. But I think it's been hugely helpful.
Oh, that's really good to know. And I think you kind of touched about it, right? Especially with, younger children, teenagers. You mentioned about some of the potential impacts of ADHD on social skills, like you mentioned, right?
Yeah.
And so I think that's a really good indication of, like you said, seeking the support that you need for that. Okay, great. So I'm going to go ahead and ask Emily next, actually. So you talked about like some of those challenges, right, that students with ADHD and TIAs have in school. So how can educators actually support these students?
Yeah, that's a great question because oftentimes you'll see educators kind of get stuck in a rut and they're just repeating the strategies that they've used. And so one thing that educators really need to be able to do is adapt their teaching strategies to support focus and attention in other students' needs. That can be anything, and it's hard to give a list because there's just so many ways to adapt strategies to support a student. So I don't even want to give a list because often you'll see lists of ideas, and those are the things that people just grab right away and they don't get creative. Other things that educators really need to focus on is just creating an environment of inclusion and fostering those peer relationships. And this has already been hit on, but it's very important that structure, the understanding, patience, routines, flexibility, providing kids with positive enforcement and building their confidence while also still providing clear expectations and consistent routines is incredibly important for our students with ADHD and Tourette syndrome, especially because ADHD and Tourette syndrome have so many overlapping similarities. And lastly, I would say that it's incredibly important for educators to be collaborating with parents and specialists and thinking outside of the box. So like I've already mentioned, often you'll see a list of accommodation ideas. Well, they should sit far away from a window because the window distracts them. They need to sit close to the front. They need extra time for tests. They need frequent breaks. You don't really want to just pull accommodation ideas. You want, as a parent and an educator, to be able to collaborate and come up with ideas that work for the specific student that is having the need. And oftentimes what works great for one student might work well for all the students, but that's not always the case.
That's a great point, Emily. I think you mentioned being like creative, right? Creative. And like you said, curating almost, right, what works for you and the individual and the parent. So no, great. That was great. Thank you so much for sharing that. So I'd like to actually go ahead and start talking about personal strategies and accommodations for individuals with TS and ADHD. So Alicia, back to you. Are there ways that your ADHD has been an advantage for you?
Yeah, I would say that because of my ADHD, I am pretty good at multitasking. I'm able to focus on a lot of different projects and things, assignments, all not like at the same time, but I could juggle things and spread my focus out among different things. So yeah, I would say that it's been
Yeah.
really helpful for that.
That's great. Multitasking. Awesome. Sophie, what about you? So have you been able to make your ADHD work in your favor? Like, what are some of your superpowers?
Yeah, so I mean, my brain works differently, so I'm always, able to think outside the box for projects and stuff like that. Also, I'm a bit of a chatty Cathy, so whenever we would watch game film, my coach would point out how I was just chatting it up with my defender and not paying attention to the play. But I ended up getting the sportsmanship award, so and I made lots of new friends.
That's
So I think it
awesome.
worked out. Yeah.
That's awesome. Thanks, Sophie. Jeremy, let me ask you, so were there specific strategies that were helpful to you as a parent of a child with TS and ADHD?
I thought of something while Emily was talking. At the beginning of every school year or every semester, I would like find out my kids' teachers. I mean, even in high school, and kind of send them an email, on the down low saying, "Hey, this is Sophie. She has Tourette. This is what it looks like." Because every now and then we'd get a teacher who would be like, is there something in your eye? One of her tics is blinking and eye rolling, and are you making fun of me? Say something to her in front of the whole class. And so I wanted to kind of cut that off if we could ahead of time. But even for my sons who don't have Tourette but have ADHD, I have two that also have autism with ADHD, so they have some kind of unique quirks. So I think one of the best supports, at least from a school perspective, has been, like you said, collaborating with teachers, but being an advocate ahead of time, being proactive, not waiting until someone comes to you to say, hey, how do I handle this? Like, here's how this, here's how this shows up in Theo or Isaac or Sophie, and here's what we found works best. Here's how you redirect him. Here's what you say when this happens. I think that's been the best strategy. And then again, just continuing to like find other people to talk to. If you're a parent of a kid who has some special needs, you got a lot going on. And so taking care of yourself. And in fact, there's lots of studies now that talk about the emotional health of the primary caregiver and how much that impacts the entire family. So one of the best strategies that I give myself is, permission to take a break every now and then, and also permission to forgive myself when I screw up and forgive others too. Those have been probably the most helpful strategies for us.
No, thank you for sharing that. And I'm hearing the proactivity and that connection. It can be so important, right, for parents going through similar experiences. So, Dr. Wiznitzer, so I actually wanted to ask you, how can providers help families understand better their child's like ADHD profile, especially when children with TS and ADHD also often have like other co-occurring conditions like anxiety, right, or OCD?
The key thing there's two key points. One is the providers themselves need to be well educated about all these topics that you just mentioned. Because if you're not well educated, as was pointed out by someone else, you may not be able to adequately sort out what's driving the behavior. Whether, for instance, if you just mentioned inattention, some of the diagnoses that you just mentioned, ADHD can cause inattention, anxiety can cause inattention, OCD can cause inattention. So you need to know what's driving the behavior because the treatment interventions are different. At the same time, the families need to be informed consumers. They need to understand what is ADHD. When you have an ADHD child and the behavior is related to ADHD, the intervention is probably different than if the child is deliberately trying to get away with something that has nothing to do with the ADHD. Maybe just trying to push the boundaries in the situation or something like that. So we need to understand those points. So you need to understand what is a volitional behavior, what is driven by the diagnosis. As was pointed out before, is there something in your eye or do you have a tic? Obviously, it's a big difference between the two of those. So when people understand their ADHD profile, they understand that they also have to understand that when you're using medication, medication improves your focus, reduces your impulsivity, reduces your overactivity. Medication does not make you learn. The medication does not make you behave. You need to impose the behavioral strategies, the educational strategies in place in order to take advantage of that improved attention span in order to make progress in your life. As I tell parents, the goal of our management in ADHD is very simple: developing good habits and avoiding bad ones. And if you do, and we're talking about good habits in interacting with other people, good habits in terms of your daily living skills, good habits in terms of educational performance, good habits in the workplace. No matter where you are, you want those good habits. And whether you have anxiety disorder, whether you have OCD, you need to then say to yourself, could those be impacting there? Do we need to do something in terms of management where it's not just treating the ADHD, but also treating the anxiety, treating the OCD, in order to basically make sure the person is functioning as best as they can and as efficiently as they can. I already heard about procrastination and issues with time management. We're talking about trying to make sure you're somewhat efficient and all these other diagnoses don't interfere with your day-to-day functioning. Let me give you the bottom line summary that I always tell my families. At the bottom line, you should be in charge of the condition. The condition should not be in charge of you.
Wow, I love that. You should be in charge of the condition. I love that. Alexander, do you mind putting that into the chat? I think that's a very powerful statement. I think our families can benefit from tonight. I wanted to turn to Emily now because I wanted to ask if you had any examples of students using ADHD to their advantage in the school environment. Like, what can educators do to support, empower these students, right? so that it's their superpower too.
Yeah. So I think it's important that educators and parents both look for these things and find them, because what we'll often see in educators and families is they're looking for, well, what is a symptom of the ADHD and what isn't? And are they doing this by choice or are they not? And, sometimes that is important to know, like Dr. Wiznitzer said, and other times it's really just important to find those positive things and really dig into them. And so both actually with ADHD and Tourette syndrome, there's a lot of positive things that I've seen. And, Sophie and Alicia both already kind of mentioned some of these. So I believe Alicia talked about multitasking, and that is absolutely something that I've seen. Some teachers really believe that a student, to be respectful and to learn, needs to be looking at the front of the classroom. That's their idea. Or a very traditional idea of what listening looks like. And a lot of students, not just students with ADHD and Tourette syndrome, but some students with ADHD and Tourette syndrome can multitask and be doodling or doing something else and still fully listening. Another thing that comes along often with ADHD and Tourette syndrome both are this unique creativity and innovation that we as educators should really try to channel into anything that, if it's a project or a problem solving task or an artistic endeavor, really trying to channel those and give the students that have these unique behaviors ways to really beautify them, for lack of a better term. And the last thing I would say is that students with ADHD and Tourette syndrome both have really unique perspectives. They've been in different situations than many of us have, and they have a different attention to detail than we do. And so finding ways to highlight their perspectives in that way is really a way, if nothing else, for educators to build relationships with their students. And what I'm trying to say is a relationship comes before learning. If students don't feel comfortable and safe, then they won't learn. So you don't have to always feel comfortable to learn. We can be uncomfortable and still learn, but we always need to be safe. And our students always need to feel like they are in the right spot. And if they feel that safety and a sense of comfortability, then they won't learn. And so teachers and educators who are really trying to boost those unique perspectives and those unique parts of students with ADHD and Tourette syndrome are just going to have better luck teaching them.
Wow, that's a great statement there. You mentioned about having that safe relationship before learning. And I'm pretty sure the panelists here tonight, I also agree. Thanks so much, Emily, for sharing that. So I'm going to switch to talking about a bit of self-advocacy here. So Alicia, can the audience hear more about, when do you find the need to disclose to others? Either it could be like, professors at school, friends, work colleagues about your ADHD diagnosis. And so can you give us an example?
Yeah, I don't right off the bat tell people about my ADHD diagnosis. Personally, in my life, I don't, with the way my ADHD presents itself, I don't find it necessary that I have to tell people right off the bat. But if it comes up in conversation, then I'm glad to share my experience and talk about having ADHD. But since it's not something that's at the forefront for me personally, I don't feel a need to tell people about it the way I do with my Tourette's.
Thank you for sharing that. Sophie, if you could explain one thing about TS and ADHD to your colleagues, classmates, professors, what would that be?
I think I would explain that sometimes it might appear to them that I'm uninterested or not trying, or there's a lack of effort, but that's not the case at all. It's just that my brain is operating in a different way. And especially when, I'm having a bad tick day, I'm just as frustrated. Like it's, hard to stay focused. It's hard to read. And so just patience, and just be understanding about it.
Thank you. Thank you so much for sharing that. Jeremy, how can parents help their children understand their ADHD diagnosis?
Great question. I think it depends on how old they are when they're diagnosed. For my sons that were diagnosed relatively young, the fast car thing was the cool, sports car with no brakes. That works. So that analogy makes a lot of sense to like a 6-year-old boy. But they don't always understand that the things that they do are connected to their ADHD. And so we have there's so many more tools now than there were even like 10 or 15 years ago. So many great books. We talk about famous people that have ADHD and how that shows up for them, and try to keep it very positive while also saying, your brain does work differently. And because of that, and because of the way our, educational system is structured, you are going to need some supports. I mean, not everyone's going to need supports. Sophie never needed any educational accommodations at all, but outside of school, she needed not lots of accommodations, but there were things that we had to keep an eye on. And, she was aware of it. And it wasn't, once we figured out exactly what was ADHD and what wasn't, we were able to put things into place. But I think just, any parent continue to investigate things that you think may not be ADHD, may actually be ADHD. And Emily, like you were saying about, what's neurological and kind of what's not, the high school years are hard. When they're teenagers, it's hard to know if they're just messing with you or if that's really, a symptom of their ADHD. And a friend of mine said, if it's a consistent thing, then it's more than likely part of whatever their diagnosis is, probably their ADHD. They just can't do it yet, whatever it is. And so just reminding yourself about that 3 to 5 year developmental delay, and even letting them know. We talk about risks. We talk about the things that are associated with ADHD. Because of your ADHD, you may be at higher risk to get in a relationship with someone who may not be very nice to you. And we talk about the risks of drugs and alcohol. I'm an addiction counselor as well, and people with ADHD are highly likely to self-medicate in some ways. So we talk about social skills too, and just all the ways that it can show up in your relationships and in school and at home. And there's some that we miss and some that I don't even know about that show up, but just continuing to educate yourself and talk with your kid. It's like you said, the relationship comes first, whether it's the parent-child relationship. I mean, parenting an adult child is a very different experience as well. Or a teacher-student relationship, as long as your child feels safe and you have a good relationship and they understand that it's about the relationship and not about finding something wrong or, finding a punishment or a consequence, you're more likely to be successful.
Oh, great. No, thank you so much for sharing that, Jeremy.
Yeah.
Emily, let me ask you next. So, we talked about like establishing that safe relationship, right, with the student. How can educators empower students to self-advocate at school?
Yeah, so this is something that I've noticed is actually really hard for educators because they often feel as though they need to have parent permission in order to have their student self-advocate. And of course they might, depending on the school district and the rules and certain expectations, they might need parent permission for their student to give a presentation in front of the class, for instance. But there's, of course, many, many ways to self-advocate that don't include doing a presentation in front of the class or any other forms of, of advocacy. I would say that self-advocacy is of the utmost importance, and parents and educators need to really, I'm going back to collaborating, they need to be on the same page on what a student can do. So a lot of times educators feel like, well, I don't even know if the student knows if they have ADHD, or I don't even know what the parents have told the student about Tourette syndrome. And that's where that collaboration comes in, because if the relationship between parent and teacher can at least be transparent, even if it's not good, even if you don't think your child's teacher is the best teacher in the world, if there can be a transparency about what the parent is okay with and what the child knows, then then the teachers can work with the students on multitude of self-advocacy, whether that's speaking up for yourself, whether it's giving a peer presentation, like I said, whether it's in the moment, somebody tells you stop making that noise, and the student then has an opportunity to kind of share about themselves. There's a lot of ways. What is most important is that the student is given opportunities to self-advocate. And that kind of means that a teacher and a parent are there to guide them, but not do it for them. So there's got to be at some point students learning about themselves. So parents need to learn all about this, but the student really needs to learn about this too, because a student has to be able to say, this is what I need. This is what works for me. This is what's important to me. This is what makes me feel this way. And if the student can't do that, and it's always the parent emailing teachers before the school year starts, or the parent, communicating with the teachers, and the kid not really knowing it, then the kid's not really a part of that self-advocating, and they're not really learning how to eventually go out on their own and do what Sophie and Alicia are doing right now.
No, that's great, Emily. I'm hearing like transparent collaboration, right? Between like the parent, the teacher, to empower the child to be able to self-advocate. So that's really valuable. Thank you so much for sharing that. Dr. Wiznitzer, so, you talked about parents being like, and families being informed consumers, right? So what is the process for a parent to seek an ADHD diagnosis? And do you typically recommend like further evaluation for symptoms beyond just the initial diagnosis process?
Well, to basically to seek the diagnosis, you first have to recognize that there's a problem, that you have behaviors that are negatively affecting your child's daily functioning. In a way, you shouldn't necessarily have to come to a conclusion that it must be ADHD. And I gave the example before of inattention, but just that there's an issue going on and we need to explore it further. Usually the first person with whom to interact is the child's primary care provider, the pediatrician or the family doctor. That person can give a lot of guidance, can also basically many times do the initial evaluation as it's needed. When an evaluation is needed, for example, it's not only information that the parent provides, but also, if possible, information that the child provides, although we can get into a whole discussion about the accuracy of the reporting of children depending on their age, as to whether they are symptomatic or not, but also getting information from multiple other sources, from the school setting, from the daycare setting, from other family members. And that way you can get an idea, is this a behavior that's only occurring in one location? Or is this an issue that's happening in multiple settings whatsoever? If it's just simple, routine, ordinary ADHD and nothing else, that might be a sufficient evaluation with then implementation of any kind of intervention. If there's more going on, we know at least 30% of individuals with ADHD have coexisting anxiety disorder. We know that 11–12% of individuals with ADHD have tics. And if all these things are going on, then it's worthwhile to get further evaluation by the appropriate specialists, whether it's for, let's say, for tics, whether it be, usually it's a neurologist who does something like that, whether it's for anxiety or OCD, which could be a psychiatrist or behavioral neurologist or a developmental pediatrician. Things on that level. Is the child have coexisting learning challenges that require further evaluation and testing, and getting educational testing or neuropsychological testing? Those are things you have to look for. Then at the same time, before the parent even does this, the parent should also say to themselves, are there factors in the child's life that might be impacting? Is my child getting enough sleep? Does my child have any kind of mood issues? Is my child on some medication that could be causing this problem? Is there something in the diet? We know that in a small number of individuals, there are certain food dyes that can actually aggravate behaviors. So we always have to keep an open mind when we're getting information. Try to get it from as many places as possible, as much information as possible, and make sure there's an appropriate sharing of it. By the way, that includes family history, because we all know, when you're saying about the evaluation, because we all know that in probably 80% of the children with ADHD, you will find some family member who who is also symptomatic or has features that would suggest it, whether or not they've been formally diagnosed, as frequently happens in my office setting, in terms of the lack of the diagnosis, but the obvious recognition. So therefore there's a lot to be done, but you just have to go in there with an open mind and provide information as it's requested, and you can come down to an accurate diagnosis that will guide the intervention.
That's great. Thank you so much, Doctor. And I think I'm resonating with what you're saying about collecting data from different settings, right? Making sure it's appropriately shared among all those, relevant to the healthcare team and whatnot. So that's really great. Well, I'm going to go ahead and that's going to wrap up just for kind of the roundtable part of tonight's event. Thank you just so much to everyone. That was really great insight. And I hope the audience members enjoyed that as well. So right, just before we launch into our audience live Q&A for the last like 15 minutes or so of tonight's session, if you don't mind, my colleague Alexandra is actually going to share a QR code. And this is a QR code for a survey because we really want to hear from you about tonight's program. So please go ahead and snap a photo of that QR code when you can on your phone. And if you have any feedback, we'd love to hear from you. So Alexandra, whenever you're ready to share that, she's going to go ahead and put that up for us. Thank you so much. All right, so I'm going to go ahead and actually look at some of these questions that have been submitted during our conversation tonight. Our first one from Jacqueline Martin, they're saying, I'd like to understand better how to separate Tourette symptoms from ADHD symptoms. Does it matter which is which? And would that affect the selection of medications for ADHD symptoms if it turns out it's only part of TS? They find the co-occurring diagnoses very confusing. So maybe Dr. Wiznitzer, you can start off with that one.
Well, remember that ADHD is a problem affecting attention span, impulse control, and motor overactivity. It is not the repetitive types of behaviors or the repetitive types of actions that we would see in the TSC in the TS population, the Tourette syndrome population. So therefore, and when it comes to tic activity, tics are motor actions, but they can also be a vocal or phonic or noises or sounds that we make, whether the words or whatever it would be. So differentiating between inattention, impulse control, and motor overactivity, ADHD, and and tics being these more repetitive types of motor actions, whether it's a physical movement or some sort of sound or noise or words that are being said, is important to differentiate, because yes, the answer is the treatments are different. The medications that we use for ADHD are not the medications that we typically see a response for tics, although there is some overlap. Medications such as clonidine and guanfacine can be used successfully in both populations and can help have a modest effect on the symptoms in both sides. But other than that, it's important to differentiate.
Awesome.
And I'll just give a plug for both organizations, both on the CHADD webpage and on the Tourette Association webpage. You can get much more information about the specific features of each of the diagnoses in order to help with this differentiation.
Thank you so much, Doctor. Our next audience member, Erica, would love to hear more about best practices for navigating employment accommodation. So it's something that they've struggled to advocate for. So anyone want to take this one, panel?
I mean, I can tackle that one. It depends on what you want to disclose, and I know that there's various reasons to disclose and not to disclose. And it also depends on what kind of work you do. There's certain environments where you can say, I work best if I have, a detailed schedule or frequent check-ins, a quiet space, a real clear deadline of when something's due. And it kind of gives the impression that maybe you have ADHD, but you don't have to formally disclose that you have ADHD. And I feel like the world kind of, contracts and expands on this one. Sometimes, we go through periods where it's like everyone is okay with disclosing. And then, we go through periods where nobody wants to disclose because they're afraid they might get in trouble. And, I think if you're concerned about your job, then it's probably best to disclose. But there's so many great websites out there that have lots of lists of accommodations that you can get if you're looking for some specific accommodations, where you can put in, what area of opportunity you have, and they'll give you a whole list of things that you can do to kind of mitigate or mediate that specific challenge. I don't know if I'm answering your question. Hopefully I am.
Thanks, Jeremy.
Yeah.
Our next question, someone asked about, any thoughts on strategies for sensory sensitivities? Yeah, I see a lot of heads nod.
Can I comment very quickly on that?
Sure.
The important thing about sensory sensitivities is to figure out why they're happening. What's the underlying reason for them? Are the sensory symptoms there because of ADHD? Are they there because of anxiety? Are they there because of OCD? That's the key. That to me is the key thing that people have to sort out. Once you've sorted it out, you can then guide the intervention. And I'll let the others comment, please.
Yes. I think Emily, you also you also were nodding. Do you have anything else to add to that?
I'm just nodding because sensory issues are something that I think a lot of families and educators see in students with Tourette syndrome specifically, but also ADHD here and there. And I think that what Dr. Wiznitzer said is exactly right. You can't really just throw strategies blindly. You do really need to know what is the cause of this sensory issue that is happening before you try out a few strategies for it.
Thank you for that. Any other thoughts on this question? I think you covered it. Yeah. So I think back to you, Emily. I think the next question, someone in the audience asked about balancing being proactive by talking to student's teacher at the start of the year, without having your child being singled out by what you told the teachers. So what's that balance like?
Well, I think parents need to be careful what they tell teachers as far as how they frame it. Things should always be framed positively. So even teacher to teacher, as an educator, when I was teaching, I never wanted let's say I was teaching 7th grade. I never wanted a 6th grade teacher to come to me and say, "Oh, you got Sammy on your roster next year," and tell me all the things that Sammy did the previous year. What I recommend as a parent is telling the teacher the positive things that your child does. And if there are strategies or accommodations that have been used in the past that have worked when your child is struggling. I would say specifically the beginning of the year is the absolute worst time to reach out to teachers, because that's when all families are doing that and they don't know the students yet. And it's very, very difficult for teachers who are seeing somewhere, depending on elementary to high school, somewhere between 24 to 150 students a day, for them to not have a face, or even in the first week, they're just getting to know people and then they've got an email with all kinds of information. So while I do recommend reaching out, I would say bursts of information are a little bit more easier for an educator to handle. You've got to remember that educators are also just humans, and they are trying their best. And most of them get a 45-minute prep every day where they have to eat their lunch and plan for 8 hours of teaching. And they need positivity. So it's incredible. I don't want to say it's not a hard balance. It was really difficult for even me as an educator reaching out to teachers about my daughter. I always, even from the preschool on, my daughter was always in the loop at some level, so that now that she is going into 6th grade, I can say to her as we're walking into her first day of camp, "Do you want to talk to the teachers about your Tourette syndrome and ADHD, or do you feel comfortable?" And she'll tell me how she feels. And so I would say, as a parent, I know the initial urge is just to give teachers all the information, but involve your child as much as you can and give teachers information and work with them in bursts throughout the year. So don't send them one packet of information and expect them to process all of that and immediately implement. And that's where I keep preaching about this collaboration, but that's where that relationship comes in. And I hate to say this, but what I found as a parent was the more positive interactions I had with the teacher, the more receptive they were to hearing me when something wasn't going so well with my daughter.
Thanks so much, Emily. I'm hearing short bursts and consistent bursts. So the next question from our audience, actually for Alicia, Jacqueline Martin would love to hear from you what the most helpful thing that your parents did once it was determined that you had Tourette syndrome.
I would say the most helpful and important thing that my parents did for me when I was diagnosed was helping me find treatment options. We tried a couple of different treatment options to manage my tics, but they found a CBIT provider for me, which was really, really helpful. And they did a lot of research to find one that was actually affordable so I could access it. Because if you've tried to receive CBIT as a treatment, you might know it's pretty expensive in a lot of places. So I would say all the research they did into helping me find treatment, because CBIT was amazing and it really helped me be able to function again properly and learn how to manage my tics.
Really great, Alicia. Thanks so much for sharing that. Let's see here. We have time for maybe about, I'd say 2 or 3 more questions. Mary Whitley from our audience is asking, how do you help an 18-year-old who is tired of therapy, medicines, etc., and just wants to be normal and independent, but needs support to be able to function? Any takers on this one?
Sophie, you want to take that one?
I don't know if this is, I don't think this is going to be very helpful, because I once tried to do this and it didn't go very well. So I have stuck to my therapy and medication, but Mom, I think you're qualified for a different approach to it.
So I have an 18-year-old right now who does not want to take medicine and he will go to therapy, but he insists that medicine doesn't help him. He's tried different ones over the years, and from the outside looking in, we're like, yeah, they help a lot. But to him, they don't seem to be helping. And so a couple of things that we've tried is like, having him help, having a conversation about what it feels like, trying different medicines to see if we can find one that takes care of whatever side effects or symptoms that he doesn't like about the meds. But then also doing kind of like a science project or like a therapeutic trial. So, okay, well, we'll try without meds for a month, and we'll see how many assignments, get handed in versus how many assignments get handed in a month that you were on medicine, or, and then we'll get them to agree to whatever the parameters are. So if you don't turn in 10 assignments, does that mean you'll go back on meds? Or, if you forget to bring stuff to school, 6 weeks in a row, does that mean you'll go back on meds? And, more often than not, it doesn't take more than a couple of weeks for him to see that they really are helping him. And, I don't make him take his meds. He's 18, I'm sure there's days where he tells me he takes them and he doesn't, and that's fine. But, as long as he understands that they do help him, particularly with the executive function stuff. And he's probably the one that is the most challenged in that area. He's the kid that, like, somewhere between the school and my car at pickup, like everything just flew out of his backpack and all the assignments were completely missing. And so, the medicine really does help him remember to turn things in and complete assignments. And so we've tried that. That's maybe not the best approach for everyone. We switched therapists at one point. The therapist that he saw when he was a kid, he kind of outgrew. And so we found a therapist that he felt more comfortable with, that was new to him. And that seems to be going pretty well. But really finding out what's going on, behind that. What are the challenges that he's experiencing, and exactly what is happening that makes him not want to take the medicine or not go to the therapist?
Super helpful. Thanks so much, Jeremy. All
Yeah.
right, I think we have maybe time for one more question. And I think I'm gonna throw this one to Dr. Wiznitzer here. There's someone in the audience who's been trying to find providers in their area who understand Tourette syndrome, how it presents with a comorbid diagnosis. They're struggling to find someone to help their child understand his behavior and how to manage his feelings and actions. So do you have any advice to help them navigate that? And I think we'll wrap up with that final question for you.
Well, the advocacy groups frequently have lists of providers who have expertise or have been identified as having the skills to deal with that. That's one step that you can do. Number two is at any of the major medical centers, especially if you're trying how let's take a child who's 12 years old. Any of the children's hospitals, there will always be somebody who has experience in managing it. Remember, if you're dealing with Tourette syndrome, it doesn't have to. It could be a neurologist. It could be a developmental pediatrician. It has to, in other words, it has to be someone who has experience with that diagnosis. It could be a psychiatrist if they have experience with that diagnosis. Don't get stuck on the specialty. Just ask what the experience is and can they manage that issue. Can I answer one very quick question that I thought was a very important one? Someone pointed out that as you get older, many people will outgrow tics. So we know that by the time you get into your 20s, about 75% of people who have significant tic activity will basically no longer have it. Doesn't mean the tics are totally gone, but really from they're almost like subsyndromic. They're not really interfering with life in any meaningful manner, even though they're there. ADHD, on the other hand, the number is much smaller, because it's what someone had asked. ADHD individuals, at the best, maybe about half of them get to the point where behavioral strategies and accommodations would be sufficient. The medication is not needed. And we have to recognize those things. These are different conditions. They may be linked to each other, but they're different. And to some degree, they have different lifespan trajectories.
Wow, great. Thank you so much, Dr. Wiznitzer. And thank you to everyone tonight at the roundtable. That was amazing. I learned so much, and I hope the audience learned just as much. So please stay in community with us. Please stay in contact with us. If you need resources, please visit the CHADD website. Please visit the Tourette Association website. You can also email support@tourette.org to let us help you figure out what you need to support your journey with Tourette syndrome. And I really want to thank again all of our speakers tonight. You were all so wonderful. And so with that, I'm going to go ahead and just make sure Alexandra did put a link to the survey and the Survey Monkey into the chat. So you didn't have a chance to snap that QR code. You can go over there in the chat and click on that link and answer our survey. We'd love to hear from you. All right. And with that, I'm going to go ahead and end our roundtable for tonight. Thank you so much to all of our presenters. And I'm going to go ahead and stop the recording. Thank you so much.